Virtual Culinary Medicine Labs, a NOSM and UBC collaboration. Nutrition and lifestyle interventions are the cornerstone of chronic disease prevention, yet diet remains underappreciated as an intervention to empower patients. Dietary habits deserve important consideration given their impact on overall health. Direct costs to the healthcare system are linked to chronic disease development, as evidenced by hospital care costs, prescription drug use, physician services, and various levels of research. Indirect costs to family members, mental health and stress levels, and loss of earnings are important considerations as well. Physicians are not comfortable, confident, or adequately prepared to provide nutrition counseling due to minimal education in basic nutrition and nutrition interventions in medical school. At the same time, Canadian medical students report dissatisfaction with the nutrition training they receive. For example, medical trainees report their ability to proficiently describe the physiology of hypertension and prescribe the recommended antihypertensive medications, yet lack the skills and confidence to give lifestyle and nutrition recommendations. Efforts to improve nutrition education gaps in medicine have been undertaken by the registered dietitian faculty at the Northern Ontario School of Medicine and the University of British Columbia through culinary medicine labs, which combine food literacy with clinical nutrition recommendations for medical learners. To mitigate logistical challenges due to COVID-19, a NOSM and UBC collaboration was established to assess the feasibility impact of virtual CMLs versus previously successful in-person CMLs at both schools. Two 2-hour sessions in the spring of 2020 were conducted, which included 47 NOSM and UBC medical and dietetic learners, an attendance rate of 82%. Between September 2020 and January 2021, an additional 5 90-minute sessions were delivered in this virtual CML space, with 4 additional sessions scheduled between February to May 2021. Additional sessions were also promoted to medical and dietetic learners at University of Alberta, Calgary, and Toronto. Topics covered during CMLs aligned with the NOSM undergraduate medical education year 1 and 2 curriculum. Chronic diseases and dietary interventions addressed during CMLs were selected based upon the progression of body systems covered in the NOSM curriculum. CMLs provided case studies, background information, and practical food and nutrition recommendations linked to the prevention, development, and treatment of chronic diseases. Academic requirements, schedules, and workloads were important to the overall impact of this venture. Time zone differences and schedules of facilitators and students and the increased impact of virtual learning overload were important barriers to virtual CMLs, especially for students. Students did note a preference for in-person learning, a trend not unique to this effort. Administration around facilities, equipment, supplies, and costs were easier to manage in the virtual kitchen space compared to the in-person labs. Virtual learning platforms, technology difficulties, and the absence of being in a singular learning environment did pose challenges. From September 2020 to March 2021, a total of 200 students registered for all CMLs, yet actual attendance was 72%. A steady decline in attendance was observed over the course of the collaboration despite reductions in session length and $10 grocery cards per section for NOSM learners. The largest impact on student attendance, one that mirrored observations made during in-person CMLs, was the fact that attendance was voluntary, as CMLs are not a part of the compulsory curriculum. Despite challenges noted by students, participants reported the teaching strategy improved nutrition competence and confidence as future physicians. The CML model is not unique, as it is widely implemented in over 50 US medical schools as simulation-based medical education with deliberate practice, a method of teaching that has been shown to be superior for skill acquisition and mastery learning, and as a method of filling identified gaps in nutrition education in medical schools. The CML model has been shown to increase nutrition competence among medical students and their familiarity with evidence-based nutrition interventions. A multi-school virtual education strategy was adopted to support ongoing delivery of culinary nutrition training across Canadian medical schools. Advances in nutrition curriculum in UME, including mandatory culinary medicine training, will prepare nutrition competent physicians, support accreditation requirements, including interprofessional learning experiences, personal well-being, and address chronic disease prevention and management. As a result, medical graduates may be better able to counsel their patients as they progress towards the entrustable professional activities for residency.